Alrighty.
You look good.
Thank you. You look splendid.
Oh, ooh, splendid. That's a new one. Thank you.
All right, and welcome to the second episode in this series of Measure the Placenta and Raising Awareness. I'm your host, Hannes.
And I'm Celeste. And if you missed our very first episode, we talked about how we lost our daughter Ellery in August of last year and how we have since channeled our grief into positive energy to create change for 2026. And for this year, that involves our Racing Awareness campaign, where my lovely husband Hannes here will run 12 marathons. And I will document the entire journey. And along the way, our goal is to raise awareness of preventable stillbirth and placental health in hopes to create a better future for these babies and families.
Prevent stillbirth where possible. So, what is different since last month is that I ran my first marathon. I brought the medal, as they call it, I guess. Very proud of it because I finished while running, which is different from my very first marathon. And so I'm currently without injuries. Knock on wood. I mean, my knee is bothering me. My IT band is bothering me. My foot a little bit. It's gonna be an ongoing battle between injuries and discomfort in muscles and that kind of stuff. Which, if you do crazy stuff in life, life gives you crazy stuff back.
I think you had a very strong start to your first marathon. I think you did great.
I definitely better anticipated how to finish and how to run and how to prepare. Yeah, so Saturday morning, 7 a.m. That's when the race started, 7:30, I think it was. And yeah, off for 26 miles. Backtracking a couple days before was me bulking, as they call it, eating way too much food. It's the kind of food that you need as a sportsman that is different. It's high in protein and high in carbs, and try not to have as many fat. So I was living off, what is it, oats. Nuts would be the fat, which is a different kind of fat, the healthy kind. And then protein bars, obviously eggs, potatoes, stuff. So yeah, that kind of stuff. And the day before the race, I've been tracking my calories, and the day before the race, I had 4,400 calories.
That's crazy.
Don't do this at home. I will not advise anybody to do this, but that helped me through the day after because based on Strava, I burned 3,500 calories just running. That didn't count for anything else I did the rest of the day because the race was only 4 hours. So you definitely need to store stuff before the race so you don't have to eat as much during, and your body has something to fuel itself with besides muscles. Because when you run a marathon of a high endurance, your body will eat itself because, I mean, it needs to fuel from somewhere. So yeah, that about food. Yeah, the race itself was actually quite fun. I really enjoyed it. The first 10 miles were pretty doable. It was around the downtown area of Athens. And after 10 miles, that was the first checkpoint with you. That might be visible in one of the Kiddos Diaries episodes.
Yes, the whole vlog, if you want to see, is up on our YouTube channel at the Kiddos Diaries. I did not have the bicycle this time because we didn't take it with us, so we drove, thinking that there would be like public bikes there, and there weren't. So then it was this, do I drive to checkpoints or do I go by foot? And I ultimately went by foot, which obviously affected which checkpoints I could go to, where I could be, when I could be. And so it kind of worked out. I met you at two checkpoints, mile 10 and 17. but those were the only places I could meet you, and they were the same checkpoint. So I just had to walk there, stay there, and then walk back to the finish. And that was important was that I was at the finish.
Of course. So yeah, the first 10 miles were pretty decent. And then from 10 to 17, that was actually an out and back on the Greenway trails, which is quite nice because I think it's along one of the old railway lines, I think. So it was very flat and elevated in some areas because of the river that cuts through it. So it's pretty cool. And then 18 to 23, that's where you really have to grind your teeth to get through those because you just ran 18 miles and your body is like, can we stop, please? And your mind says no, because we still have 8 to go. And so it's between 18 and 23 that is the real tough part, because then at 23 you're only 3 miles out and the finish is within reach. It's not getting any easier, but it's mentally a little more doable. Then in 3 hours and 50 minutes, that's when I crossed the finish line.
It's amazing. And you did something very symbolic at the finish line, which I wish I could have captured better on video, but next time I will, now that I know what's going on. But tell us about that.
Yeah, so a couple months ago, I had the idea of doing something crazy at the finish line, like very symbolic, because people often compare a pregnancy with a marathon. 40 weeks, 42 kilometers, very similar. Your body goes through a lot of changes, and it's your baby's in your belly for the long run.
It's an endurance.
It's an endurance, yeah. And so I thought, what if I take my kitty's shoes, or the ones that were supposed to be hers, and put them in my backpack and run with them. And before the finish, I'll take them out and symbolically drop them before the finish as a memory for, in Ellery's case, you almost reach the finish 40 weeks, and in her case, 1 day. And that's where that's couldn't have made a stronger statement in that sense. It was captured by one of the news down there.
Yeah, the red and black captured us sharing a kiss after the finish line, so that was fun. And then another photographer who was there capturing photos for the race captured a photo of her shoes right there at the finish line.
I'll do it for another 11 marathons.
I think it's a very symbolic move, and I think it was one that everyone knew what it meant at the end. You could tell by the reaction. I would love to have something next marathon with some information, I guess, maybe. I did have a sign that had something about push for empowered pregnancy and stillbirth, and then I had our racing awareness little sign, but I've been brainstorming ways to bring some more information to some of those events.
Yeah, we'll definitely improve from him in terms of how we go about all of this. One of the things that was very interesting for me during the race was many people are shouting like "Go, go, Angel Daddy," because that's one of the things that's on my shirt. And then I started asking like, "Do you happen to know what it means?" Because they were all very happy and like, "Oh yeah, Angel Daddy." And I'm like, "Do you actually know what it means?" And they were like, "No, what does it mean?" And then when you tell them it's because you lose a child, that's when people like make a click in their head. It was very interesting to see. Nobody knew what it meant. Everybody that I talked to, I mean, it was only 10 people, so it's not really a good analysis necessarily, but it was very, very shocking.
I guess so. Before this, I never thought about what that meant either.
No,
I think I'd heard it before, but I never thought about what it meant really.
if you don't come across any of that stuff in life, then you don't have any reason to look into it, I guess.
I almost wonder if because I know you're passing these people so quickly, and I feel like leaving them with like, "Oh, yeah, it's because I lost my daughter," and, like, you keep running by, it's just, like, this shock to them. You don't really have time to be like, "But I'm doing this run for her, and this is why, and da da da." But I almost wonder if you had something on you that if people ask, you could just give them. just like a short little, like a little card, you know?
Right.
Hi, I'm Angel Daddy. Da, 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 da.
Yeah, I could.
Just a random thought I just had.
I'll be gladly doing it the first 17 miles, and then and then my mood changes, and I'll just be focusing on me finishing the race.
Well, at the finish line, we also had two people who came out to support the campaign and you running. So that was really awesome. Two people who have also lost children to stillbirth. And they reached out over Instagram and said, hey, like we live in Athens and we would love to come out and support. So that was really great for them to be like, so enthusiastic and excited to come out to the event and support and cheer you on. One of the ladies took my phone and had your dad on my phone and was making sure your dad could see you finish while I was standing closer to the finish line with the camera videoing. And so that was fun. And just talking to them about their story as well was great to connect with that community.
Yeah, the similarities there are quite a few actually. It's quite interesting how even the grief part. I think it's quite interesting how in this kind of grief situation it's different from a family member. Interesting to see how they went through the same grief and in a similar way that we did.
Yeah. It's also nice to be able to talk more openly about it because I feel like people who haven't experienced it aren't always as willing to talk as openly about it.
Or they're scared of our reactions and are afraid that they might hit a very sensitive nerve. But in essence, it isn't. It's very hard to hit that kind of nerve. We love to talk about Ellery, and so did they about their child.
Yeah. Yeah, one of the ladies even said, she's like, I'm sure you love talking about Ellery. I love talking about my son. And it's like, yes, someone who understands. And so, yeah, I mean, it's hard when people don't ask about it sometimes when you know it's like, it's there, it's in the air. Yeah, but no, we love talking about our experience. We love talking about the memories we have of Ellery. I also think it's just for so long and still is becoming less so, but a taboo subject like loss and grief and stillbirth because since we've of course come to talk to many people who have experienced something similar, but in the most random ways too. At work, I just randomly was talking to someone and we discovered that she also had a similar experience with a stillbirth many, many years ago. But it's like, wow, it was just a connection. It was a bond that we had, but it's not something that's as openly talked about. And she didn't share that until I had shared my story.
Yeah, not something you like to talk about. Not everybody wants to hear your story either. But it is part of you, and it's not necessarily, even though it's a negative experience, it doesn't necessarily mean it's a negative story. So I would say to the people out there, don't hesitate to ask about it. We do like talking about it. We don't want to be in the dark. I mean, every person is different, so obviously, if you know the person, that might be a different situation. But I guess for the people that we've met so far, they're all very open and willing
To share their story, yeah.
Yeah.
I also think sharing these stories is a part of creating awareness of it, which is a huge step in trying to do something about stillbirth.
That is one, and also it's a way that you process as a parent, process a story by talking about it. But me running was not the only thing that we did.
That's true. Yes. We're forgetting another big part of that
You
weekend.
went to try and spread awareness at the source.
Yeah. To, to the provider. So we stayed in Athens and first of all, we got up at 2 a.m. on Thursday and drove 6 hours there because you had to work. And I had the intention to go to clinics that day to hopefully talk to the providers, talk to the people at the clinic about stillbirth prevention and something called EPV, which stands for estimated placental volume. And it is a calculation that involves three measurements of the placenta taken during a 2D ultrasound, and it helps give an estimated weight and size of the placenta, similar to when they get measurements of certain parts of the baby at a 2D ultrasound to estimate the baby's weight. It's the same kind of concept. And so I had a bunch of great resources that Measure the Placenta, which is a nonprofit organization we're working with, gave me. And I went from clinic to clinic and told them who I was, what I was doing. And I will say, overall, people seemed open and receptive to the information that I had, and they seemed interested. I feel like for most of them, it was new information. They never heard of it, and so they were interested.
It was new information, but yet you go to an OB clinic. The people that deal with placentas on a daily, no, well, they should be dealing with placentas on a daily basis because it's the one organ that grows together with your baby. Never heard of it. That is so shocking to me.
Yeah, it is crazy because the placenta is so important for a pregnancy. It is the life sustaining organ, as we talked about on our first episode, life sustaining organ for these babies. So many stillbirths are claimed to be unexplained, but we actually can have a cause to the majority of them. There's research out there done by different doctors. One of the ones we've talked to personally is Dr. Kleiman from Yale, who specializes in pregnancy loss and placentas. And in one of his research studies of these unexplained stillbirths, he was able to find a cause for them, for the majority of them, over 90%. And it's just that we're not looking into it. And even in our case, we had a placental pathology report done for Ellery's placenta, and the weight of her placenta was noted on there, but nothing was said about the fact that it was too small. But it was. And I think there's just a lack of knowledge and education out there. But, and also in his research, finding a cause, the main reason was a small placenta. And so you'd think that if that's the case, we would be measuring the placenta to help reduce stillbirth.
You would think so, yeah.
I mean, nearly half of term stillbirths like ours are preventable, but it doesn't seem like anything is being done to try to prevent this nationwide. There's research out there in terms of the tools that we can use, like EPV. It's just not being used.
Let's bring some change to that.
I'm hoping at the very least, me going to these clinics and sharing the information at least gets the idea of EPV in their head. And maybe even if they're not receptive or follow through with it now, I'm hoping it will come across in their field later on and they'll be like, oh yeah, I heard of this. Now I'm really intrigued. I'm just hoping it ignites something.
I mean, that's the least we can do at this point.
Right. And so that was Thursday. And then Friday, we went to Atlanta. You had to renew your passport. And so I took advantage of going to some of the clinics there as well. And I went to, what, 15, 16 different clinics in total.
Something like that.
So pretty happy with that. And right after the marathon, well, a little bit after, I guess we hung around for a little bit, but we pretty much had to start our journey home.
Yeah, to make it back before the ice storm.
And I'm very glad we ultimately decided to do that because we would not have made it home otherwise.
No, it would have been Tuesday.
Yeah.
Because the roads were so icy.
And then by making it home, you got to ice skate through
the neighborhood.
Of our neighborhood. That's
Yeah.
how much ice
There was like an inch of ice on top of the streets, and so prime time to have your skates out and get those sore muscles running again.
Right. It was quite fun. I had spikes that I put on my shoes, handy tool from upstate New York. And we just walked around. Well, I walked around the neighborhood. You skated around the neighborhood. Dropped off some hot cocoa, tea, and cookies to some neighbors.
As encouragement to our neighbors.
Stay warm, guys.
Only upwards from here. Because the next one is going to be in Phoenix, Arizona.
Yes.
So that will be fun.
Yeah.
Whole different climate. But still, people give birth in that area. So yeah, there you have it. We will be going to Arizona next week, actually, to get ourselves ready for the second marathon. That one is all downhill. I'm looking forward to that one. I might set a PR, maybe.
Ooh, now's your chance.
Yeah, right. Let's not have any knee injuries in the meantime. So, Phoenix, Arizona, if you're in the area, reach out and we would love to meet up.
Yes, the goal is to still connect with some more lost families or not. If you just want to come out and support, that'd be amazing too.
Or talk, know some information, that kind of stuff. Or help in any way. If you want to do your part in the Phoenix area, because we can only be there for so long, I'm more than willing to talk.
And we'll be in Arizona for a week and a half because we're kind of doubling this marathon with visiting two very good friends of ours and their new little guy. So that's going to be really fun, I think, to be there for the week and be able to hang out with them. And then we're volunteering the day before the race at the expo. Of course, I'll be going to clinics. I have a whole list going already.
Sure you do.
Phoenix is a huge area, so I mean, I could go wild if I wanted to go wild, but I'm trying not to. I'm trying to be selective about some of the places I'm going and focus on really some smaller places because I do feel like I understand healthcare is very complex and it's not as simple as getting one provider interested who's a part of this huge healthcare system because it's not ultimately their choice. So I'm trying to target more private OB clinics to hopefully get individual providers at these clinics interested in EPV and wanting to do the free training that's offered, learn more about it, and implement it for their patients. Because there are providers around the country who do implement EPV, but it's a select few.
This needs to grow.
It does. That's the goal.
Cool. Okay. Yep. So next week is Arizona, and then the end of March we will be going to Asheville.
And our goal for each marathon is to raise $500 for Measure the Placenta. And so we would love to reach that $1,000 mark for the Phoenix Marathon. We did reach our first 500 for the Athens Marathon, so now we're looking to get to 1,000. So if you're interested in supporting in that way, you can go to measuretheplacenta.org/Ellery and click donate.
Yep. I'll the gift better.
Yep. All that money goes to the organization to help with awareness efforts and research.
Awesome.
Yep.
I believe it's then time to introduce our first guest.
Yes, very exciting that we have our very first podcast guest, Dr. Ann O'Neill, who is a stillbirth prevention advocate who is anticipating the arrival of her fourth child, Elijah, in July of 2018. The day before his due date, she noticed decreased fetal movement, which prompted a visit to the hospital when a nightmare descended when Elijah no longer had a heartbeat. After extensive testing, Anne was told Elijah's stillbirth was unexplained. However, with persistence, further research, and with the help of Dr. Kleiman, Anne and her family got an answer. Elijah's stillbirth was due to a small placenta. Not only that, but Elijah, weighing 8 pounds, 13 ounces, had far outgrown his placenta to the point that it could no longer support his life. His death could have been prevented by measuring the placenta, much like our daughter Ellery's. Since Elijah's stillbirth, Anne has become passionate about helping families who have experienced a similar loss, and she has become an advocate for stillbirth prevention and placental measurements. Anne is the founder of the Minnesota Stillbirth Prevention Association and a change maker for Push for Empowered Pregnancy. One of her most notable achievements is the fact that she founded Measure the Placenta, a nonprofit organization with a vision to implement placental measurements for every pregnancy to improve birth outcomes. She's here today to talk with us about her work within the organization, as well as the impact made by the all-volunteer-led group.
Yeah.
I did it!
Wow.
I don't know how I did it, but I did it. Please welcome Dr. Ann O'Neill, Elijah's mother. Ann, thank you so much for being here with us today.
Thank you so much for having me. I'm very glad to be here.
We just thought we would start by you sharing your stillbirth story, maybe by first talking about the pregnancy itself and the days leading up to the stillbirth of your son, Elijah.
Yeah. So in 2018, I was pregnant with our son Elijah. He was our fourth child, is our fourth child, I should say. And this was after 3 very healthy, uneventful pregnancies. So I went in with, in hindsight, too much confidence. I just expected a healthy living baby, just like my prior 3. There were no red flags. The only concern I had was he was breech, and I just, in my mind, the worst thing possible was a C-section. I was trying to avoid a C-section. So I had a couple ultrasounds at weeks 35 and 37 to confirm that he was breech, and then I would keep doing the exercises trying to get him to, flip around so I could have a vaginal delivery and avoid the C-section. So that was my biggest concern the last couple of weeks of pregnancy. Yeah, I had good prenatal care. I had scans that were affordable. I had kind of the best you could have hoped for in terms of care. But it didn't work out. He was in peril, and we had no idea. My care providers, me, no idea.
Did you notice? I mean, this was your fourth child. So, did you notice a difference in the pregnancy for Elijah versus the other ones that looking back after this, you think maybe those were signs?
I do have written down that my morning sickness was worse with Elijah than the previous 3, but I didn't think anything of that because it wasn't crippling morning sickness. It was just I felt kind of nauseous and wanted to lay down. It didn't prevent me from doing, essential life functions. So I don't really see that as a warning sign. In hindsight, I do think his movements slowed down some. I was not trained or told about that. So this is me just going back in my memory, and I didn't even think to track that or look at it. But I do look back and wonder, I do suspect his movements did slow down, but I wasn't aware. I didn't know that was important. With the knowledge I was given, the lack of knowledge, I should say, I wasn't told that, for example, that stillbirth was an outcome that might happen. That was, and I knew stillbirth was a thing. I'd had 2 friends prior to this with full-term stillbirths. And so it was very much on my radar that it could happen from their experiences, but I still felt safe. I felt like, I've got 3 living babies. It's super rare. It probably won't happen to me. I remember feeling like I wanted to be a good patient and not be a burden to my care providers by asking them, I'm worried, I'm anxious kind of questions like, how do I know my baby will be here safe? And, is there anything proactive that I can be doing to care for my baby? I just wanted to be the calm, cool, collected, experienced patient who was just easy for them. And that was more of a burden I think I put on myself just from norms in society. It wasn't my care providers. They would have answered the call had I called them. They would have encouraged me to call if I was worried. But it was just my own kind of mental hurdle, I guess, that I had to get through that. No, I'm not being a difficult patient to ask questions, be concerned, be proactive. That's actually a good patient who will do that. So in that sense, I look back with regret that I was more concerned about being a good patient than I was concerned about the safety of my baby. But no, like, clear red flags. I wasn't bleeding. I didn't feel sick. I, I, I don't know, like, looking back, what could have been done other than, as I'll share later, measuring his placenta and looking at, is his placenta healthy and able to sustain him through the rest of pregnancy. I don't know of any other clear test or thing I could have known or point of education that would have prevented his stillbirth other than those placenta measurements.
I was reading a little bit about your story on the organization's website, and the day before his due date, if I'm not mistaken, you noticed lack of fetal movement or decreased fetal movement. Is that right?
Yeah.
And that prompted you to go to the hospital?
Yeah. And unfortunately, by that time, he was probably already dead. By the time I was like, this isn't right. Because, yeah, I noticed the lack of fetal movement in the morning. It was like 10 or 11 a.m. on a Sunday morning. I was just kind of at home, like, when am I going to go into labor? Oh, that was one thing. With my previous 3 children, baby was delivered by 39 weeks. And so I remember thinking, oh, it's weird that with Elijah, I'm here at 39 weeks and 6 days, and he still hasn't come yet. But again, there I thought, oh, babies, there's just variation. The past doesn't predict the future. So I was just like, well, I got to be patient until it's time for this baby to come. But yeah, it was that morning I didn't feel him moving. And that's what prompted me to call my care providers. And they said, well, they did actually give me the juice line. One care provider did. They said, drink juice and lay down and see if you can feel him move. And I did that, unfortunately. We now know that's terrible advice. If you're concerned that baby isn't moving, you should just go right in. I called back maybe 30 minutes or an hour later and said, he's still not moving. And that's when they said to come in and get checked out. And so we did. We hustled down to the hospital. And that's when we learned he had no heartbeat. So by the time that I felt him not moving, I believe he had passed. I believe he died the night before. We don't know for sure, but that's my best guess. And so probably when I woke up that morning, he had already passed.
Mm.
And I wasn't monitoring his movements. So the fact that it took me until like 10 a.m.-ish to realize, wait, something's not right. Had I been monitoring his movements first thing in the morning, I might have caught something in time. I don't know. I'll never know.
You might have caught something, but that doesn't necessarily mean that you caught it in time to go to the hospital and prevent it regardless, because there was nothing that was no signs up to the event.
Yeah.
So that's what it's the same for us. It's you notice when it's too late. Period.
Mm-hmm.
There's nothing that you can do to track it beforehand other than measuring the placenta.
Yeah, I think that's a misconception with a lot of people is they say, well, if there was an issue, there would have been a sign in the pregnancy, but that's not always the case. And although sometimes it is, it's not. In your case, in our case, I felt movement just a couple hours before her heartbeat was not detected. And it's like Dr. Kleiman has said, it's like the gas gauge in a car, like
Yep.
it'll work until it doesn't.
Yep.
There's no warning signs.
Another analogy I've heard, it's like falling off a cliff. Like what actually gets compromised biologically is baby's kidneys, I guess. And so they're fine until that last bit of kidney function finally falls. And it's like the death can come very suddenly. It doesn't always happen that way. Sometimes there is, an extended period of reduced fetal movement or sign of struggle or some sort of sign of compromise. But a lot of times there's not. It's just very sudden, which means we need to do better in the prenatal care monitoring and kind of the time leading up to it if there can be these sudden fatal fatalities.
What was it like from that point in the hospital, learning that Elijah no longer had a heartbeat and going forward from there? What was that experience like?
Yeah, so I remember going into the hospital still, I was worried, obviously definitely concerned. I'm going to the hospital to see if my baby's okay. But I still thought he would be alive because it was like too horrible to contemplate that maybe he had died. Like I knew that was a possibility, but it just still seemed like, no, that's other people, right? Like the odds are good that he's still alive. And I call it like the descending layers or levels of hell, where they took out, a small hand probe to look and try to find his heartbeat, nothing. And then they took out a little bigger machine, still nothing. And then they wheel in the big, ultrasound machine and still nothing. I remember the doctor with the ultrasound machine, so they're looking at images now of his heart. And like one clear thought of like, she can see the heart. It wouldn't take that long for her to know if the heart is beating or not. You see the ultrasound and the heart is clearly beating or it's not. So why is she taking so long to find my baby's heartbeat? And so she actually never said, I'm so sorry, there is no heartbeat. She just kind of waited for me to put two and two together and said nothing. And I threw my head back and just wailed, like, it's not going to take a doctor this long with an ultrasound probe to find if there's a heartbeat.
Similar story to us, to you.
Yeah, but they did tell us there was no heartbeat.
True.
But we could also see it. Like they did
Right.
have the ultrasound picture facing us as well.
So you could see it. Did
Yeah,
your
we could
medical
see it.
training, I know you're interviewing me, but did your medical training kick in at all? Like I know the parts of the heart, and I'm curious what that was like for you as a medical provider.
I mean, when they put when they put the Doppler on before the ultrasound and there was no heartbeat right away, like I knew at that point because I had an appointment 2 days prior and they put it on and immediately I heard her heartbeat. But when they brought the ultrasound, I mean, it was just black. I just remember it was just black. You know, like you saw her outline, but then like right where they were focusing, it was just black. And I was just at a loss. I was like, what? You know? Because I told him, I said, I knew something was wrong, but I wasn't really expecting there to be no heartbeat, but I thought something was wrong. Like was still worried, but that was just terrible. The worst outcome.
Yeah. Yeah. You just think like, I remember thinking like, that's too horrible to be true. That can't happen. Like in that was 2018 for me. Like in the year 2018, does this still happen? And I had friends walk through this, right? Like, but there's some kind of mental block where it's like you don't want it to be true. And it's just hard to come to terms with like the worst news that you can imagine in that moment. I remember feeling like Elijah died 3 times because it just took time for me to come to terms with reality. I call Elijah's first death when I learned with the ultrasound, like, I didn't hear the words, but I learned there is no heartbeat. And just throwing my head back in tears of devastation. And then I actually went home for a while to pack supplies and such, and then come back to the hospital later that evening. I asked him to give me a drug to just help me sleep. I was just I couldn't sleep. But I knew I had labor coming up the next day. And I knew from my previous 3 babies, this was going to be a lot of work. Just the nightmare of trying to, labor and deliver a baby who is dead is what I actually did. And I don't know, I don't know how many other lost moms do this, but I almost tried to like convince myself that he was still alive. It was like, what can I do to distract myself? What can I do? I didn't want people in my room crying because it was just, if I lost it, then I didn't know how I was going to deliver Elijah if I was just in a mess of tears. So I asked people, please, if you need to just cry, including my husband and my friend who is my doula, if you need to have a good sob, go for it in the hallway. Yeah, because I just felt like I needed to save my energy for the work of labor. I remember asking if I could have a C-section, and they said, well, we strongly recommend against that. And it's so personal. There's no, I know many families do have a C-section, but I went with their advice. I do believe they were trying to look out for me as best they could. So we were, I was in labor for maybe 12 hours, and he was born Monday evening, July 2nd at a little after 8 p.m. And I remember that being the second time that Elijah died, when he was born and they put his lifeless body into my arms. And again, I just remember throwing back my head, like, I can't keep lying to myself anymore that like maybe he's alive, or maybe they made a mistake, or maybe he's just, going to go to the NICU for a long time. Like when you're holding your dead baby, it's like, I can't just pretend anymore that, maybe they're all mistaken. So that was the second death. We spent the next day in the hospital with Elijah, July 3rd. And I remember that being honest. Well, I woke up and my first thought was, is this just a bad dream? And then I look over into his cot and see that he's still dead in his cot. Like, nope, this is not just a nightmare. This is real. But I remember spending that day with Elijah, and it slowly turned and just like sweet, I guess I would say. Like I wanted to hold him. I knew that this time with him was very short, very precious. Yeah, I didn't want to set him down. I would pass him off to other family members who wanted to hold him. But other than that, I just wanted to hold him and study his body um and be sad. We had our living kids come to the hospital and visit Elijah, and people often ask like how did they respond? And all 3 of our kids had very different responses. The youngest was age 2, and he had no clue what was going on. So he was like pressing all the buttons in the hospital bed and kind of like just running around, oblivious. Our second son was terrified of Elijah's body. He just wanted to hide and run away. He understood that his baby brother had died, and he was just terrified. And then our oldest son, at the time he was 7, he wanted to hold Elijah, and he understood that this was his only chance to hold his brother, and he wanted to take pictures with Elijah, and he really leaned in. So, I don't know, everybody was so different. And then I guess I would say Elijah's third death was when we had to say goodbye to his body at the hospital. And I just remember standing there in the hallway holding him and just never wanting to let go. It's like, can I just stay 15 more minutes? And they were like, yeah, you can. You can stay 15 more minutes. And then that would be done. And I'd say, can I just stay a little bit longer? I'm not ready to let him go. But the inevitable came and I had to pass him off to the midwife. And I just remember crumpling into like a pile on the floor. Like I couldn't stand, I couldn't move, I couldn't walk. I didn't want to say goodbye. So I remember them kind of helping me get to my feet, and my arms were grasping like I needed to hold my baby, and they gave me a box of Kleenex and a teddy bear and led me out. Having said that, my care team did do an excellent job. I don't know what they could have done better in that moment. They did a great job, having someone come to take photos, capturing memories. There's an org called Halos of St. Croix Valley who sent a lost mom also whose fourth son had been stillborn, and I was like, what? That's crazy.
Oh my goodness.
So she was an absolute refuge when I just had no idea what to do and how to survive this. So grateful for that. Yeah, those are Elijah's 3 deaths.
Similar story in many ways.
Yeah.
Ours was 8 years after yours. Yeah. I remember the toughest part for us, because we wanted to... I mean, I wanted to go home in the first place that same day, because I guess part of reality in my brain was like, yeah, there's nothing to change here. There's nothing that's gonna change. But I wanted to finish the story myself by putting Ellery in the little purple box. I think that was the one thing that I'm very grateful for, that the funeral person allowed us to do. It was Saturday afternoon, and they drove over and brought the box and all that stuff. It's painful, but it's in a way closure that you need to give yourself, even though there are many other parts on your shoulder, devils on your shoulder, saying don't do it. But that was an important part for me.
What is the purple box? Help me understand that.
That was the box that they brought to put Ellery in as like a
little casket. I guess.
Okay, gotcha.
Yeah.
Did they put her in that before they took her away, like to the funeral home?
We put her in ourselves.
Yeah, he did.
So that was, the kind of closure.
Were there things for you in the days or weeks after Elijah's stillbirth that you felt like you had to do to help give yourself closure?
Yeah, I remember pouring myself into planning for his memorial service. That was like my happy time, was, picking out the songs and the flowers and just feeling like this is the only way I know to mother you right now, is by planning your memorial service. So we had his memorial service like maybe a month after he died, month and a half, something like that. I remember one thing I really appreciated was friends coming to visit, and I put together this small photo album of maybe 20 of the photos we had from him, from the time in the hospital with him. And I treasured it when friends came over to sit next to me, cry with all of us, our whole family, and look at the photos. And I always felt like the people who looked at Elijah's photos, like Elijah's more real to them than like anybody else who hasn't seen photos of Elijah. And I appreciated that very much. And I had one friend who reached out in amazing ways. She just, she's not had a stillborn baby, but she knows that grief is something you learn to incorporate in your life. It's not just something of checkbox that you're finished with. And so she invited me to come to her house once a month for the year following Elijah's death to just say, how is grief sitting with you right now? What does grief look for you right now? And those monthly check-ins became a real anchor point in my life for the first year after Elijah died, where I looked forward to them very much. And because grief gets so complicated and heavy, and it's like, this is a friend who I know is going to be there once a month, and we're going to just check in and hash through it all together. Yeah, I remember that being super helpful. But also just the meals and the gifts and babysitting, watching my living children. It made me see my living children in a whole new light of like, wow, I took your safe birth totally for granted. You are a walking miracle that you're here right now. So in that sense, like, it made parenting my living children better, but it was hard too because I just was drained. I had no energy. I didn't really want to get out of bed for the first week or two. And meanwhile, have kids who need mom. I think the other thing, though, too, I've had to be careful with parenting living kids afterwards is not being driven by fear. Because just Elijah, he was here and everything was totally fine, and then poof, he was dead. And I know that could happen, even to my kids who, have made it this far in life. And I just want to be so cognizant as a mom to not be like, don't do that, look 10 times before you cross the street, and having them grow up in just a world of paranoia and fear. So I've had to work through that with a counselor to say, no, there are healthy precautions to take and reasonable precautions, and we want to take them. But we also need to not live like, we're going to walk and be hit by a school bus every day. So yeah, trying to not instill that fear in them. By nature, I'm kind of a let's go adventure and do crazy things kind of person, not 12 marathons in 12 months kind of crazy, different kind of crazy, but I'm generally like, hey, let's go adventure. Let's take risks. Let's do all of those, exciting, adventurous things. But I would say Elijah, I'm still that way to some extent. That's still my default, but I'm more cautious now for sure. Just as a personality, I'm less likely to even things like introduce myself to a stranger. I'm less likely to do that now after Elijah's death. I know I'm just personality a little bit more reserved than I used to be. I think it's just the weight of stillbirth that it just kind of adds into your life of, I don't know, it's made me more circumspect and it's made me more grateful. I think both. Having said that, I had a good support system and, my husband and parents, but wow, it just transports you to another world to be learning to survive life after a stillbirth.
It sure does. Do you think any of your kids changed? The 2-year-old might be a little too young at that point. But like you said, the 8-year-old kind of had the idea.
So we have different ways that we remember Elijah now, like in our daily lives. We have pictures of him up on our piano. The kids obviously see me doing lots of measure the placenta work, and they know I'm working hard to try to prevent stillbirth. And so that leads to a lot of really good family conversations of like, wow, look at what Elijah, obviously I would give anything to have him here, but the wake of his death has left some major important fingerprints in our life and truly changed the trajectory of my life and our life as a family. I think ways we remember him, we have pictures on the piano. We have certain songs that we sang at his memorial service that we still sing together as a family, like Children of the Heavenly Father, because that's been a song that's been in my family, and it was sung in Swedish in prior memorial services in my family. And so that's been a special touch point in our family. We call them Elijah snuggles. We do once a month where we just snuggle as a family on the couch or in bed. And we think about how old would Elijah be if he were alive right now? And what might he be like today if he were alive? Okay, he would be 7 years old. And let's see, when you guys were 7 years old, you loved Legos or you were super into hockey at that point. Or, we just kind of try to imagine like, what would life be like if Elijah was here? And that was actually started by one of our kids going through grief counseling. And it was actually our second, I'm remembering it now, our second child, Matthew, in kids grief counseling. He was worried that we would forget Elijah. And, at the time I was like, I don't think we're going to forget him, bud. But, I've never walked this road either. So
Right.
What do you want to do to make sure that we don't forget Elijah? And this was his idea. He said, let's do Elijah snuggles once a month and just talk about Elijah.
Aw, I love
Awesome.
that. That's
That's been a sweet way that we sort of integrated Elijah's memory here. And now because I do help lead an org about stillbirth prevention, I find myself constantly talking about Elijah, just talking with friends, what we're doing, talking with researchers, sharing Elijah's story because of that. So Elijah is not far from, honestly, anything we do.
That's awesome. Yeah, I think that's so important in all of this is to still remember your child in your life and that they are a part of you and a part of your family.
Now it is going to be different for us than it is for you, because this was our first and this is your fourth. So it's going to be a whole different dynamic.
Yeah.
Which is going to be interesting to see how it plays out.
I'm just imagining, like, if you are to have, living children in the future, telling them the stories of your marathons of like, 12 marathons for Ellery, right? Like you're creating your story right now. That's just like a story begging to be told.
Yeah, that's why we video document everything. Even before this, we've documented by videoing like all our travels together. And that was, we call it the Kiddos Diaries because it was always intended for like our future kids. So we definitely intend to continue to do that with the marathons and other things. So our kids can look back and at all of those memories and remember what we've done and Ellery, all of it.
My knee injuries will speak for themselves.
I have a sneaking suspicion you guys are going to just keep talking about Ellery, for the rest of your life, and she's not going to be far from your hearts or minds or any future living children that you might have.
Well, as Anne was saying, she's still talking about Elijah almost on a weekly basis. So I guess that's the transition into part of the reason why we have Anne on, and the reason why we will have other guests on too, is like, how do we change this grief into positive change?
Well, yes. But first, I do want to hear, we didn't really talk about the cause. So I want to talk about.
Right, the cause comes forward.
Yeah.
Well, like, it ties into it. The
Ties
change.
into it. It
Yeah.
does. So tell us about how you came to understand what happened to Elijah that caused his stillbirth.
When I first heard that he was dead, I was absolutely terrified to search for answers because I thought, well, for sure, the answers are just going to come back and say, it's my fault. I didn't do something right. I ate the wrong food. I changed the kitty litter. I didn't actually change kitty litter. Your mind just goes a million different places and you think it's probably my fault. I was his primary caretaker and I failed. So I remember at first, just initially in the hospital, I was like, no tests. I don't want to know anything. But that changed within about maybe an hour or two of learning about his death. And I realized I'm a scientist by training, environmental science, though, not medicine. And thinking, okay, I got to at least collect the data before it's too late. So I changed my mind pretty quickly. And wow, am I grateful I did. Sadly, I was told in the hospital, you can do an autopsy, but, quote, you probably won't learn anything.
Same for us.
Were you told that too? It's very, very common. And there definitely is a chance you won't learn anything. But what the insidious hidden meaning there is like, it's not worth it. It's not worth the money. It's not worth the time. It's not worth your emotional energy, right? And that is so wrong. Total conflict of interest, if nothing else. Anyway, thankfully, I said, nope, I want an autopsy. Even if I know I'm probably not going to learn anything, just do anything you can. So I did have all the testing done. I remember 3 months. I asked them, how long does it take to do all this? They said, give them 3 months. 3 months passed, still no word. And I was like, you expect me to sit here forever and wondering why my baby died? Finally, I reached out, eventually got the report back, and they said, no known cause of death. This was the hospital pathologist who did this. And I thought, okay, maybe it's just the end of the road. I'm never going to learn why my baby died. At least I tried. But then I was listening to a podcast of all things, ironically, maybe I've come full circle here. And I learned that babies, it was Dr. Kleiman was the person being interviewed. And I learned that babies can die because they outgrow their placenta. In other words, the ratio between the weight of the baby and the weight of the placenta is really important. And Dr. Kleiman said on this podcast, 6-to-1 is normal. So a baby 6 times the weight of its placenta, normal and healthy. 8-to-1, 8 times the weight of the placenta, is getting dangerous. 10-to-1 is almost always fatal. Very bad. So I ran home and I was like, oh, I wonder what Elijah's weight was compared to his placenta weight. I divided the two numbers and sure enough, it was 10-to-1. It was actually 10.1-to-1. And I was like, oh, that's interesting. So I pretty quickly reached out to Dr. Kleiman, had all of Elijah's records sent there. And he was like, yep, because everything else was normal, healthy, fine. There was no other concerns, but his placenta was very small. I ended up learning it was less than 3rd percentile, whereas Elijah's body weight was 81st percentile. And that mismatch is what killed him. But even then I was like, well, this is crazy because on the pathology report, it said his fetal placental weight ratio was extremely high. It was over the 97th percentile. And I remember asking him, like, is that an issue? Do you need to look into that more? Like, how extreme how small was his placenta? And the pathologist at the hospital, the original one, just said, doesn't matter. I don't really know. Not a big deal. Quote, it won't bring him back. So I'm like, great. My questions are irrational. Is that what you're saying? So it really very condescending comments that he gave me. Anyway, I was very grateful for Dr. Kleiman's report and like, okay, I'm not crazy. It can be a problem. And then I remember thinking, well, how well established is this in the medical literature? Maybe it's just like this one guy at Yale who's concerned. So I go to Google Scholars, start, hammering out research papers, and it's all over the place. Papers linking increasingly small placentas with an increased risk of stillbirth. And I'm like, this is crazy. Why does nobody care about this? It's in the literature, but it hasn't made its way into medical practice. So that was my process of finding out why Elijah died. And I was shocked by how proactive I needed to be, by how much the pathologist at the hospital kind of didn't care. Actually, in the pathologist at the hospital who didn't care, he had been working as a pathologist for maybe 30 years, and I was only the second patient to meet with him. It's just not common. Usually they meet with OBs and then OBs meet with patients, but I just felt like it was important for me to talk directly to the pathologist. And since then I've learned there aren't actually very many trained placental pathologists. The guy who did Elijah's autopsy is just a general pathologist. And I've since learned too that, placentas are just kind of overlooked and dismissed even in the pathology world, just like in the obstetrics world. So there's a lot of things broken about the system, but I don't realize this as I'm just a patient, a first-time lost mom. I don't know any of that, but there's a lot of gaps in the system, unfortunately, that also need to be fixed. But
did you also talk with your providers after learning about the small placenta to see if they had any input?
yeah, so I'm actually still good friends with my midwife. She's a fabulous human being. And she read the pathology report when it was first released, and she told me, and I appreciate her honesty. She's like, I don't understand what this is saying, and I don't understand the implications for like medical care and future pregnancies. So she said, you just need to talk directly to the pathologist, which I appreciated her saying. I've since learned like OBs, midwives, they are not trained to read and understand stillbirth pathology reports. We've actually done surveys of OBs, like, hey, what % do you believe pathology reports after stillbirth are important? Do you understand them? And it's very clear there's just a gap in knowledge. And they also don't understand what implications does this have for future care. It's not part of their training, and it's just not standard. So maybe that's a theme, but like there's just so many gaps where this can be done better, right? OBs should understand pathology reports and integrate the results of them into the care of the patient. So yeah, I wanted to talk to my midwife, but she just said, I don't know, I'm not sure.
I might be the only non-medical here, but also lost in translation a little bit. But what does the pathology entail exactly?
The report, so that would be the autopsy report. So they measured so many things about his body. They did probably cut him open and they looked at his heart. Does it have, all the valves and chambers that it should have? They measured his kidneys and his spleen and his head circumference. And I mean, there's tons of measurements of his body. There are a couple measurements of the placenta. They noted the length of the cord. They noted if there was abnormal twisting. They did weigh it, thankfully. The pathology report is summarizing all of this medical data about Elijah's body and what they learned.
So then, if I'm understanding correctly, from a medical perspective, a pathology report, not many medical advisors, whether you're an MD, whether you're a PA, whether you're a nurse, whatever, the placenta is not really understood. It's not part of training. It's not part of maybe your interest, not part of your expertise. And expertise comes from interest, I guess. But so, am I correct saying that it's not part of your training?
Yeah, well, yes and no. I mean, I wouldn't say it's totally not part of the training for OBs. But we do know the NIH has said that the placenta is the least understood organ of the human body. It gets, the least research, the least attention. And it is really hard to study the placenta. So I'll give them that. But given that it is absolutely 100% critical for the survival of a pregnancy, that's a good reason to study the placenta right there.
Right. It's also the short-lived, if I'm not mistaken. It only lives for 9 months and then gets tossed.
Yeah, it's the only organ that we grow and then, deliver and dispose of, right? There's no other organ that's anything like that. So definitely wins points for being unique. That's an interesting question. Like, what do OBs learn about it in training? I'm sure they're learning stuff about the placenta, but sadly, they're not learning things like smaller placenta equals higher risk factor for stillbirth, or techniques on how to measure it, or blood tests, or placental function, things like that. I know that's true because when we go present at conferences and, we talk to OBs and care providers like, hey, we're an org that wants to see placentas measured during pregnancy. And they say, oh, yeah, that's right. We don't really measure the placenta during pregnancy. That's interesting. And I'm like, well, try not to hide my annoyance, but that's true. Like they will say we don't measure it during pregnancy. So they're studying, the theoretical underpinnings and importance of the placenta, but not how to measure it, how to monitor it, the health and function during pregnancy.
Yeah, we recently met with a maternal fetal medicine doctor about a week ago, and the goal is just to talk about the small placenta, future monitoring, but she was very dismissive and not even really wanting to talk about it at all. When we brought up EPV, she just said she's familiar with it, and that was it. She just kind of cut me off. Like, she did not want to hear what we had to say. She also, right then and there, like, went back and looked at the placental pathology report and did her little calculation. She's like, "Oh, it's fine."
It's 1/10.
And
10. It's fine.
and I was like, "No, that's not true." Yeah. And also, it kind of got me thinking too. When we got our placental pathology report back from Dr. Kleiman, he made a comment that the weight noted in the report was an untrimmed weight. And so he did a trimmed weight, and that, of course, made the ratio even larger, and made the weight of her placenta even smaller. It was abnormal even as an untrimmed weight, but she didn't even recognize that either. And I also don't think she even really considered Dr. Kleiman's report at all during our call. It seemed like she hadn't even looked at it, because she also told us that we would still never know, that she's sorry we didn't have answers for the cause. And I'm like, but we do. Did you even read Dr. Kleiman's report?
We talked to a number of providers who are brick walls like that. It's so discouraging. This was your MFM for Ellery's birth? So they're not going to say this, but there's legal concerns. If they, admit fault or engage with you, or, like, they're probably told by their system that they have to be careful what they say to you.
Really sad.
Very sad.
It limits the care you can give if you only think from a liability standpoint.
Yeah.
Because we just want to, even if it's something that you don't do yet or right now, it's more like, hey, can we engage in this path to improvement together then? Let's search for ways that we can train your people. Let's search for ways that we can have this done. Maybe we might be the first ones. Heck, even if we have to sign a document that they can't keep us liable for whatever.
Yeah.
I'm willing to do that.
But
Yeah.
it's like, you're willing to go, like, okay, next pregnancy, what if this happens again and there's no EPV wasn't done? What's it going to take for these providers to, like, recognize and realize, like, this could have been prevented?
That's a painful place for them to go, right? I mean, just that self-doubt of, what if I did something different and maybe this family wouldn't be living the trauma that they're living right now? That takes a brave soul to go there. It's not an excuse for them, of course. I mean, the best doctors would, of course, lean in and say, wow, let's really look at this. Let's learn about trimmed versus untrimmed placentas. Let's get into the weeds a little bit. It's not uncommon for them to just keep going, and not really look down. One thing I did learn, that, like, a stillbirth to an OB, a busy OB might have one stillbirth a year. So if they just roll the dice, let's say they're with a patient right now who's having a stillbirth, they can just roll the dice, and it's very likely that they will not see another stillbirth for a year or longer. And so there's very much this temptation to say, it's rare, I'm not going to engage, my next patient will probably be fine. That's obviously not good practice. It's not good medicine, but it might be kind of human to do that and say, this is hard and I'm just going to walk away. And I think that's obviously a huge problem because we need, and thankfully there are wonderful souls who will lean in and they say, you know what, I want to take a look at this and I want to learn what happened and what went wrong. And I want to learn about these risk factors and, incorporate that into care. But it's a big lift, sadly.
Yeah.
Well, it's part of the experience that we can share now doing all this.
Yeah.
I'd rather go through it ourselves and bring positive, active change instead of other people that are more torn apart because of this. I mean, all respect to you. You're allowed to feel torn apart if you experience this, but then at least we can bring it up and maybe advocate for even more change.
Yeah.
And it's been 7.5 years since Elijah's stillbirth, but you've done a lot since then, including creating Measure the Placenta. How did that even happen?
I always say this was not on my life bingo card. I'm an environmental scientist by training, not a nonprofit, hey, let's start a new nonprofit kind of a person. Measure the Placenta started because I was chatting with a friend, just telling her all the things I had learned from, the useless initial pathology report and Dr. Kleiman's report, which was very helpful, diving into the research, showing, hey, there's a strong correlation between abnormal placenta size and poor birth outcomes. And I was just waterfalling information to her. And she was like, you should start a website. Just share this information. And I was like, well, you're crazy. I don't know the last thing about, making websites. So she's like, well, I know a little bit. I'll help you. And about that time, I happened to meet Alicia, who's now my co-pilot, I should say, in leading Measure the Placenta. And she's a behind the scenes, do all the things kind of a person. There's nothing she can't figure out or research or anything. And then we met with another lost mom who designed some of the content of the website and another designer who did our logo. And I can't even believe it. But it was about a year from the time we decided, let's try making a website to having a website. And about a year later that we had it. That was critical. Obviously, it gave us something to stand on, to aggregate information, share information, ways for people to contact us. Pretty soon I connected with two other lost moms, Amanda and Erica, who now are a big part of running our social media. And, that helped Measure the Placenta explode in terms of awareness because we were now on Facebook and Instagram. And I don't touch social media with a 10-foot pole if I can help it. So they've been critical in just helping get the word out and awareness. And as far as the growth of MTP, again, I was just laughing with my husband about this the other day. I was like, I do water quality studies. I don't know anything about nonprofit work. When the right people come at the right time and just add on and build, and you get little pieces here and little pieces there to make the org stronger and the shared mission, I'm amazed by how it's grown and come together. And even, you guys reaching out to us, and then you're like, you're going to help spread awareness with marathons. Like we've almost become like an anchor point or a hub for people who do want to get involved, who do want to say, you know what, my child's death was a horrible, horrible moment in my life, but and also there can be good things that come out of this by preventing it from happening to other people. Yeah, our crazy thing in the last year is that we became an official 501c3 nonprofit last, I don't know, October of 2025 or something like that. That felt crazy to me because I just didn't know the last thing about starting nonprofits. But, teamwork makes the dream work. And we you reach out and get things done. And we're very much volunteer led. Nobody is paid. Although we always feel very complimented when people assume that we're paid. We're like, thank you very much, but we're just volunteers. And so we make progress as we have volunteers available to, bite off little projects or little chunks of things. And so we grow where there is volunteer, willingness to pitch in. So it's frankly, it's been an amazing ride. I'm so grateful for how it has developed, and we see a need. I should share our org mission. We want to see placentas measured during prenatal care as a risk factor for poor outcomes because, like we've established already, placentas are essentially ignored during pregnancy, and placental issues are the number one cause of stillbirth. And they're related to a whole host of other poor pregnancy outcomes like NICU stays. And so we just see this as a massive gap in prenatal care, the fact that we're ignoring placentas. We need to measure their size and their function to get a clearer picture of, okay, this baby seems fine right now, but what about a week down the road? What about a month down the road? Is this placenta healthy enough to carry this baby through the finish line? Or would it be safer, better to induce at 37, 38, 39 weeks? There's obviously a scale, and we need to weigh. You don't want to be inducing a 28-week-old baby. That would be bad. But it's also it's a problem if we're just completely ignoring the placenta and not considering if maybe a 38, 39-week delivery would be prudent. So we want placentas measured during prenatal care and not just after a stillbirth.
The one thing that I am very interested in knowing, and this might be a Dr. Climate question, who will also be part of this podcast in some months from now, is I can't imagine that every live baby is born with the perfect ratio of placenta. So we can assume that some babies are born with a small placenta, some maybe with a big placenta. And I'm interested to see, if there is a big diversion, but the baby makes it, what are the complications in life from that small or big placenta?
Yeah.
There might be things, but we don't know because it's not measured. So let's say you have a small placenta and you have kidney issues as a baby. Maybe there's a correlation. Maybe there is. That might be something interesting to know.
Definitely ask Dr. Kleiman about that. He can tell you way more. But I will say, too, you can go to our website and you can see a whole host of factors that are associated with an abnormal placenta. One of them I happen to know is ADHD. Babies with abnormally small placentas are more likely to have ADHD. Isn't that interesting? There is so much biology going on there that I'm sure we have no idea most of it. But isn't that really interesting? The same thing with heart abnormalities. Babies with really small placentas or really large placentas are more likely to have a whole variety of heart abnormalities. So there's definitely something going on, that's linking them. It's not that, it's not random. And so I'd love to see a world where every baby's placenta is weighed, I should say, in the delivery room. Number one, just for research data, for research purposes, but also just for that data and information. If a child gets diagnosed with ADHD and then they're wondering, was the placenta functioning well during pregnancy? Well, right now we have no idea because we don't even collect that data in the delivery room. It'd just be lovely to have this data. And we know, given that the fetus relies entirely on the placenta for its survival, is it really all that shocking that we're finding these associations? Not really. But we're not really acting like it. So here's my plug for more placenta research and data collection. Yeah, if somebody wants to learn more about that, we have a whole list of research articles on the placenta, and we have it kind of organized by topic. And one of the topics is after delivery, what are some of the increased risks if a baby's born with a small placenta or a very large placenta?
I guess that might bring us to the next topic, or larger topic. So Measure the Placenta, that's the organization, the nonprofit. And I think first, when we got to know you guys, it was more you reaching for answers and reaching for research and that kind of stuff.
Yeah.
So that is very valuable, all the information that's on the website from Measure the Placenta. So are similar stories, or people's stories are written out on the website so you can associate. But then I guess the next question of the big topic might be, what are some of the things in 2026 and 2027 for the short future that we, for Measure the Placenta, want to focus on in terms of awareness, in terms of research, in terms of that kind of stuff? Is there a game plan for this year?
Well, yes and no. The game plan, because we're so volunteer based, if somebody has a specific skill and if you come to us and say, hey, I've got, marketing or website design or, fundraising, can I help? And we will say, yes, you can help.
So this is the plug that if anyone's listening and has a skill,
reach out
we would love
and
you.
we would love to work with you. So in that sense, we're very nimble. We're very flexible. We don't have a 3-year plan that we're going to follow to grow, right? It's very volunteer dependent. Having said that, we do have dreams. We have projects. We have cool things coming up on the horizon. One that there's a number of things I could mention. Well, supporting you guys is for sure a big deal. We want to get you guys out on social media, support this podcast, keep going with that. Another thing we have coming up on June 1st. Do you remember how I said that ideal ratio was 6:1? Like ideal ratio is baby is 6 times the weight of the placenta. So we decided June 1st, 6/1, is going to be Placenta Health Awareness Day. It will be the first one maybe ever anywhere. I don't know how to prove that, but it could be the first one anywhere ever. But for this Placenta Health Awareness Day, our goal is to be very positive focused of like, hey, did you know your baby has a placenta that is absolutely essential to their survival? And have you ever wondered if it's healthy? Have you wondered if that placenta is doing well? If it's up to the task of keeping your baby alive through, 9 months of pregnancy?
Especially delivery.
Yeah, through delivery. If a baby is stillborn during, it's called an intrapartum stillbirth, and that's like 10 or 20% of all stillbirths. So there is no like, I mean, it sounds so doomsday, but there is no safe zone in pregnancy, right? That maybe goes without saying, but I know culturally we tend to believe, oh, after first trimester, I'm good, and then I can start telling people that, I'm pregnant. But that your risks of a loss have gone down for sure, but there isn't a safe zone, and we really need to combat that. So on this Placental Health Awareness Day, we hope to drive home the message, is your baby's placenta healthy? That's a question you should care about. Just like you might want to care about if you're, eating raw meat or sub sandwiches or painting your baby's room pink or blue or whatever. Like you also need to wonder, is my baby's placenta healthy? And is it going to carry them through the finish line? I would love every person who's pregnant to be just thinking that and wondering that and asking their provider about that. And even just for patients to know right now, nobody's looking at your baby's placenta and its size and health and function. It's just not a part of standard prenatal care. Even if you're high risk and seeing like an MFM specialist, they're looking at all the downstream effects. Is your baby healthy? Is your baby gaining weight? But what if I'm in the environmental world. We always say, what if we look upstream at some of the causes of these poor health outcomes? That's also really, really important. So yeah, we have Placental Health Day coming up. We're also working on a website revamp. So if anybody has website skills, we'd love to have you. Or design. Right now, our website is very much like an information dump. And it's got a lot of information for all the people in just one big bucket. And we're like, oh, it'd be good to target that of like, we need providers, a little bit more targeted information compared to lost families, compared to people who are currently pregnant, and just kind of funneling people in the right direction a little better. So we always have things going on.
So one thing I was thinking about when you were just talking is getting the information about placental health to people who are pregnant. I think that is one thing I've struggled with recently. We have friends who are pregnant, but also I'm in a girls group chat, and somebody last night announced that she's pregnant. And one of my first thoughts is just, your placenta, ask about your placenta, get your placenta measured.
Yeah.
But I also I feel like I'm hesitant because I don't want to instill this fear in them and put them in a position where they can't get that. Because at least for us, like we've had difficulties talking to our providers and getting the placenta measured for a future pregnancy. I don't want to put anyone in this position where I'm giving them this information that they can't get answers to. They can't get their placenta measured, but now I'm just like causing anxiety and fear.
Yeah, I mean, I think it's a really good question. And it's so tricky too, because we already have stereotypes as women of like, oh, women are too anxious, women are too fearful, and so now you're like, okay, there's even more. But I don't know how you combat like a public health crisis without arming people with information. And you know what? If we can deliver babies, we're pretty strong and we can handle the two truths at the same time. Number one, stillbirth is horrible and it happens, and there are things you can do to prevent it. And it's not super likely. It doesn't have to paralyze you. It doesn't have to put you in, a big bubble of fear, and crippling anxiety. You can have a both and, right? Like we're capable, competent human beings here who can do hard things, and we can hold those two truths together at the same time, which is true, I think, for any public health crisis. Like, let's say you're trying to prevent the spread of malaria, right? You want to educate people. You want to educate them on the risks. Take the proactive steps that you can. Get a bed net. Do whatever you can do. And you don't want to live in crippling fear that you're going to get malaria, right? You want to go live your life and have a normal, happy, healthy existence. while proactively taking the steps you can. So I always wonder, like, why is stillbirth this like super unique thing where it's like, we're going to withhold information. We're not going to tell you that stillbirth is a risk. We're not going to tell you to measure baby's placenta. We're just going to not talk about it, period, in hopes that maybe the public health crisis will be averted. Like, no, knowledge is power. We've got to share information and trust that the people, listening can hold that tension, because we have to solve a public health crisis. Otherwise, how do you solve a public health crisis without talking about it? So I don't know. Like I totally get you in the sense of like, I don't like walking around and telling every pregnant friend, hey, your baby might die. That's not cool.
I mean, that's a true factor whether you have all the health conditions or
Yeah,
not.
yeah.
Because pregnancy is such a high risk endeavor to begin with. Even back in the day, and it's still in many cultures today, that babies don't have a name until they reach day 5, day 10, something like that. Back in the day, back in Belgium, people had 10, 15 kids because 15% or maybe 50% didn't make it until the age of 5 or something. So we've definitely gone a long way since, but easy preventable stillbirth, like measuring your placenta, that might be one of those things that we can add.
Yeah, I mean, I know you know this statistic, but the US ranks 183rd, I believe, out of 195 countries globally in terms of reducing stillbirth rates. Why do you think a country like the United States is doing so poorly to reduce stillbirth? What can we do differently? And what is it that you think other countries are doing better than us to reduce stillbirth rates?
I'll answer the positive side of that question first. Norway is a shining star in terms of low stillbirth rates and reducing stillbirth rates. It's amazing. They collect data like nobody else's business. I mean, it's just amazing, all the data that they're collecting about everything. Then they make it available to researchers to study. They are also more open and willing to deliver if a baby's in distress. In Japan, another shining light, they get so many scans in Japan. I was just talking with a researcher there, and if a mother wants an ultrasound like weekly or every other week, sure, no problem. So they're just going to catch issues. They're going to catch issues faster and more frequently than here in the US.
Japan also has a population issue, so they might want to save every single baby that's out there.
Yes, yeah, with their demographic, declining population. I think they really like care that every baby is born alive, and they're willing to put their money where their mouth is and fund absolutely, excellent prenatal care. So, yeah, so why don't we have those things in the US? And placenta measurements too. How do I say this diplomatically? ACOG is a huge brick wall for us for making progress. I remember so ACOG is the American College of Obstetricians and Gynecologists. They are the top professional organization for obstetricians and gynecologists. And they put out guidance on, best practices and what doctors should do in XYZ cases. And they play a really important sort of gatekeeper role in what research gets implemented and what does not get implemented. So I remember after Elijah died thinking, oh, well, I should just go talk to ACOG and make sure that this problem of stillbirth is on their radar. And surely they're very actively working on this because, wow, this is devastating. Surely they want to end every preventable stillbirth out there. And sadly, that was not our experience. We talked with some of the leadership in ACOG, one person in particular, and he was very dismissive. He said we should go talk to Congress to fix this. He said we should go talk to celebrities to fix this. He said the lost families should start a council and figure out the problems and go fix it. And I was just, I was working with a colleague, Sam Banerjee, who I think you're gonna interview, and we're both thinking, that's crazy. This is your job, ACOG. This is your job to end preventable stillbirth. But they just have shown no willingness to engage. We even told them things like, could you just suggest what research you would like to have done to be convinced that you should measure babies' placentas? So, for example, if there's a research gap, no problem. Let us know. What is that research gap that you want us to help fill and fund? They have not responded to that, in spite of sending them literally thousands of letters asking that question. They just are not interested in engaging. It's very frustrating.
Is there any reason why you think that is the case?
I can only guess. So everything you hear me about to say is a theory. I do not know for sure because, I mean, in my mind, it's their ethical obligation to care about this. As providers, as the lead org, this is your job. You should care. So why don't they? I know that ACOG, the guidelines they set are very influential in lawsuit cases, and they don't literally define what is legal or what the standard of care is. It's not quite that simple. You have to talk to a law person to get the scoop on that. But ACOG guidelines are very influential, we'll say, in setting the standard of care. And so I think there's a conflict of interest there, right? They're trying to look out for their members, for the OBs, for the doctors. And if they're trying to minimize lawsuit risk, then having lower standards protects their doctors legally. And so, I mean, I just think it's an inherent conflict of interest for them to be looking out for the doctors. And somebody needs to look out for the doctors, right? Like I'm not anti-doctor here at all. And somebody must make sure that they have the protections that they need, that there's not frivolous lawsuits, that people aren't going after them willy-nilly. But it should be two separate orgs, the ones that are, you know, they're protecting the interests of the doctors and the ones who are setting the care guidelines. Those should be two different orgs. We need both. They're both critical. But they're not independent. They're not unbiased, shall we say, when they're setting care guidelines. And I think that's a huge problem.
Wouldn't you expect then like a governmental entity would set the guidelines?
I guess I'm really hesitant to have government setting prenatal care standards. I mean, that should be left to the professionals, the doctors, the researchers.
Yeah. That's the data that they base their guidelines on.
Yeah, for sure, like collecting data.
I'm guessing here too, but I mean, in Belgium or in Europe, I think that might. I mean, every law is, you would expect at least every law that's written is based on certain data that they collect and improve the world based on that.
Yeah, I mean, there certainly a role for government for sure would be collecting data, analyzing and aggregating data, funding research is really important, and that would come from government. And we've had some successes in that in the last 5 years, but nothing near enough. And even like there is no org right now in the US that is trying to like implement the research that is being done on placentas and trying to translate it into clinical care. That is just a massive gap right now. ACOG's not trying to do it. There's no government. It's nonprofits who are like, hey, this is a problem. This is a gap. We need to fix this. I would love to see a professional org take that on. You know, the doctors, the MFMs, the midwives, and say, this is a gap in care. Let's fix it. And they could put together a council, a research advisory board, calling for research. That's the other thing we asked ICOG. Could you just tell NIH that we need more research in this area on funding placenta measurement tools to be incorporated into prenatal care? And they were not interested in even doing that, not even calling for more research on this. And yeah, just kind of leaves me baffled and frustrated.
So just long story short, there's no interest in the wider community, medical community, to even do anything about the placenta. That's basically what it comes down to.
Yeah, that's so discouraging to hear you say that, but I can't disagree. I'm not seeing it. And it keeps coming back to like, ACOG, do your job. OBs, MFMs, like, and I know they're super busy, right? They've got their heads down. They're working hard, caring for each individual patient. And we need those doctors and MFMs to look up and say, oh my gosh, look at this wide landscape. Looking for like a public health kind of big picture kind of a thing. How can we stem the tide at the public health level instead of just each individual patient, you know, and giving them the best care that they can? But that's hard to ask a busy practicing OB and MFM who, you know, maybe haven't trained in public health or, you know, they're busy. They're really busy people.
What do you think would make the biggest impact? Do you think it's more targeting awareness and getting this idea of measuring the placenta and the importance of it out there? Is it getting research done? Is it targeting ACOG or another organization?
It's finding your celebrity.
Find a celebrity.
Yeah.
We are open to any and all of the approaches that you listed, you know, and then some, because I don't know I like, we've thought so long and so hard about it. Like, what will be the thing that breaks through, that, breaks the dam, and finally placentas are measured during prenatal care? And one day I might be convinced that it's one strategy, like, we've got to get through to ACOG. And the next day I'm like, no, we got to find an OB. And the next day, no, we need awareness. We need like bottom up pressure to, so is it like top down strategy or is it bottom up strategy? Like, we run in circles. And the answer is, I don't know which one of those is going to be the breakthrough thing that finally brings this into sort of the public consciousness and makes providers determined to figure out this question. They will oftentimes say more research, and more research is always helpful, right? Like, of course we want more research. And who's going to translate that research into clinical care and clinical guidelines? Or maybe it's like a brave OB or MFM just saying, you know what, because a number of practices that we currently have in prenatal care, it started by just a forward-thinking provider saying, you know what, this makes sense. And I know the research isn't perfect, but there's a convincing enough amount of research. I'm just going to try it and see what happens. And they do it in very limited, specific cases. And then it kind of, as they get comfortable with it and they see kind of how this tool or thing works, then it spreads from those innovative forward thinkers.
Isn't that one hospital in New York City one of those examples?
Yeah. Are you familiar with Mount Sinai? I'm assuming you are.
Yes. So Mount Sinai, and they thankfully have been willing to do EPV on many patients. We also had some concerns that they weren't doing it correctly, and we haven't been able to connect with them about, hey, what can we do to make sure that this is, gold standard of care? I don't know actually their current status, if they're willing to have them or not, but we did have some concerned patients who just weren't sure that they were doing it correctly.
So what is Mount Sinai doing different than any other clinic?
They have a rainbow clinic, it's called. I have not kept up with it in like the last year or two, so I'm not the best person to ask, but they're trying to just give excellent care to patients who have had a prior stillbirth. We had hoped that they would collect data for us on the EPVs they were measuring, but we couldn't convince them to do that. And I just thought, oh, such a golden opportunity to just collect data and learn. But we weren't able to ever get that from them, sadly.
What do you think on a smaller scale? So if someone's listening to this and they're wondering, how can I help as an individual? What do you think is the single most effective way for somebody to get involved or help make an impact?
Yeah, we're always looking for willing volunteers. If you have a specific skill set that you think would help, a nonprofit, it could be, I don't know, spreadsheets and paperwork and tax compliance, or making a website, or spreading the word, social media skills, fundraising. If you have any of those skills, fabulous. We'd love to have you. If you're thinking, oh, but that's not me, I don't have any of those skills, I measure water quality, not specifically anything to do with stillbirth, then feel free to sign up for a mailing list. We have action item alerts that go out once in a while, like, hey, email your senators or representatives. For example, we'd love to see the Shine for Autumn Act get passed. It's federal legislation that would go towards better stillbirth data collection, among other things. So we have action steps like that. Or recently, the federal government was discussing cutting funding for PRAMs, which is some of our best maternal health data that we have during pregnancy, and they're talking about cutting it. So we asked people, hey, reach out and put a comment in why this is important to you to keep this funding going. Yeah, we had an op-ed campaign that people can join. So feel free to write an op-ed to your local newspaper on why this is important and why this matters to you, getting placentas measured during care. So there's so many ways to get involved. And we're happy to, so shoot us an email if you're like, I'm not sure how to get involved. You can even just join our monthly meetings and just sit in and listen. We're very transparent. You can read all our notes, read all of the whatever you want to read, and just listen in. And yeah, you'll find ways as you're like, oh, that project I could plug in here, or this other thing. And maybe that's for a season, and maybe that's for years and years. Whatever you can do is great. Even as simple as if you're expecting, just ask your doctor for placenta measurements. It's the worst they could do is say no, and maybe they'll say yes, and maybe it will save your baby's life. Right? Just ask. It's free to ask.
Is there a option? Let's say there is a couple that has the ability to weigh the placenta afterwards. That is the easiest thing to do. And let's say they're also able to get the measurement beforehand because they have an amazing doctor that wants to do it. Is there a way that they can upload the information?
Yeah, there used to be something like that, actually, that Dr. Kleiman was running. You'll have to ask him more about that. And I think he stopped collecting data because people were not using it. There wasn't enough people submitting data. You should ask him about that, though. That would be amazing, though, if we got to a point where there was enough kind of groundswell of interest and their awareness was out there. Yeah, I don't know of anything like that. Having said that, if that's you, I would be, and this is just anecdotal, it's not like contributing to a research project, but I'd love to hear your stories. Like if somebody gets placenta measurements, how did that go? What was that like for you? What did your doctor say? How open were they or not to giving the measurements?
Oh, yeah.
I should say we get a wide range of responses to that question. We just had a doctor from Florida who said, sure, I'll do EPV and I'm happy to be listed on your website. Like, great, thank you. So now if a patient emails us from, I don't know where in Florida, I'm sorry, I have to look at the website, but if a patient emails us in Florida, then we can say, hey, yeah, this doctor will do EPV. And we also have a non-public list of doctors who will do EPV, but we can't put it on the website because we haven't gotten their specific permission to do so, and they're very hard to get a hold of. So feel free to email us and we can tell you of the providers we know on our non-public list who, for example, we've had other patients successfully self-advocate for EPVs. And so just based on that personal story, we share that this doctor is possibly likely may be able to do EPV for you.
Yeah. Awesome.
Awesome. Well, I think before we wrap up, I just have one more thing I'd like to ask. So, if somebody is listening who has recently gone through a stillbirth or maybe not so recently, what is something that you would want them to take away?
Especially if it's a recent stillbirth, or actually even 10 years out from a stillbirth, I would want them to know it's not too late, probably not too late, to get answers or to get probable causes of your baby's stillbirth. I certainly did not know this when Elijah died, but the placenta is not technically part of the mother's medical record. And so you don't have to sign anything for the placenta tissue to be saved by the pathology department. It's just automatically saved by most pathology departments. So you can go back 5, sometimes even 10 years later and say, hey, can you look at my baby's placenta tissue? I want a pathologist to look at that and see what they find. So if you're kind of wondering if you could maybe still find out the cause of your baby's stillbirth, no guarantees, but you very possibly can. If that's you, feel free to email us and we can give you more information. But I would also encourage anybody, it's a very personal decision. There's no right or wrong, but in my experience, I hear lots of families who are very glad that they pursued the cause of their baby's stillbirth. And I hear families who didn't pursue a cause who then are regretful. And so if you're in that moment of confusion, I don't know what test to get, I don't know what to do, I feel just horribly sad and I don't know what to do, I would just lean towards getting the testing done. That turned to be very significant for me. I know for many lost families that I talk to, it is a big deal to get that testing done. Even if it's scary and it's the unknowns and you don't know what's going to happen, I'd say still go ahead and do it. All else equal.
Awesome.
Well, thank you so much for talking with us and sharing Elijah's story and your story and all of the work that you guys are doing with Measure the Placenta. It's been great having you and talking with you.
Thank you so much. And thank you to both of you guys for all this. We just feel inspired by your energy and your love for Ellery and your enthusiasm to get the word out there. So thank you for pouring your love for Ellery into meaningful change.
Yep.
Thanks, you guys.